And retained teeth, they do cause problems. So it's not just a cosmetic issue, with their mouths looking crowded, but they do push the adult teeth out of normal alignment. And there's also a tendency for food to become trapped, which can really quickly result in dental disease, which unfortunately is really a very common problem. It's a common source of pain and infection. Take a look inside your dog or cat's mouth. Have they got a shark mouth as their teeth absolutely everywhere? Well, if that's the case, it might be that they've got retained baby teeth, and that can be a real problem, which is exactly what I'm going to be talking about today.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hello, and welcome back to the Call the Vet podcast. For those of you who are regular listeners, you'll have known that I was taking a little break in January and the latter half of December to spend time with my family. My children were on their summer holidays, so I'm down in New Zealand. It's summer here, although you'd be forgiven for thinking that it might not be the case with the weather that we've been having, though. Thankfully, we've started to hit a little bit of a heat wave, which is very welcome indeed. But anyway, that aside, I'm back here with the Call the Vet podcast, where I'm answering all of your pet health questions, whether it's about how to prevent disease, how to keep your pet healthy in the first place, how to pick up on the fact that they might actually be unwell, and the things that you need to think about when it comes to treating them, to helping them with whatever life throws their way. And I'm really grateful that you're here, sharing your valuable time with me. And if you are listening for the first time, then welcome. Don't worry, there's not normally such long breaks. Like I say, I was just taking a little bit of time off over the new year, the summer period here. And yeah, I'm definitely fully refreshed and raring to go. Although I did actually just spend the last 20 minutes trying to fix up my microphone stand. After being packed away for a little bit of time, it was a bit of a fiddle getting it all back together. But yeah, if you're new, make sure you hit that subscribe button so you don't miss out on all the future questions, the future answers, which will definitely bring some really important insights into your pet's health and the things that you might have to come across and you might have to deal with either in the short term or in the future. And then just before I jump into today's question, I wanted to let you know that today's episode is brought to you by my free cat care guide. So this is the free guide that gives you some really valuable information to let you know what you need to do to help keep your cat as happy and healthy as possible so that they can be the best version of themselves that they could possibly be, and you can keep them out of the vet clinic. So this is a completely free guide. It's got some really actionable points, and you can download that today at ourpetshealth.com/petcareguide. But anyway, that's it from me with the intro. Let's get into today's question. And so the first question of 2020 was sent in by Celia, who wrote in to say, my 5-month-old barn-bred kitten is a normal, cheerful, playful little critter, but her teething mouth looks like something out of Dracula. For the past week, she's been growing in her upper canine adult teeth, but retained the deciduous set as well. And these teeth are sitting side by side in pairs, two clearly on the right and two clearly on the left. And both baby and adult teeth, they're almost the same length. Now, there's a bit of redness around the gum, which Celia's sort of expecting, but there's no apparent discomfort. She's eating well. Her kitten's actually been neutered a few weeks ago. The lower adult canine teeth haven't erupted yet, but she is known to have an undershot jaw. So Celia's question really is, should I be concerned that the deciduous canine teeth have been retained? And she then goes on to say, how long do I wait before getting them seen to? So this is a great question. It's actually something that is really not all that an uncommon thing that we come across in daily practice. It maybe happens to me, certainly the patients that I see, maybe kind of a couple a month or something like that. And that's going to depend on obviously the workload and the number of kittens and puppies you're seeing, as well as the breeds, because certain breeds are definitely more susceptible to getting this, especially when we're thinking about dogs. A lot of the time it's our very small breed dogs, our toy dogs and our brachycephalic breeds that have this problem. So the problem really is that normally when the adult teeth are growing through, and very often it is the canine teeth, so the big kind of pointy fangs, the Dracula teeth, as Celia so eloquently puts it, they're the ones that often are retained. So rather than the adult teeth growing through and pushing the baby teeth out and then being lost as normal, Instead, they really just push them to the side and they're retained so they don't fall out as you would normally expect. Now, in most dogs and cats, the deciduous, the baby teeth, are fully erupted by 2 months of age. So all of the baby teeth that you'd expect are there by 2 months or 8 weeks of age. And usually by about 6 months of age, they've been replaced by the permanent adult teeth. So Celia's cat at 5 months old is not quite at the age where we'd expect all of the adult teeth to have been fully erupted and all of the baby teeth to have been lost, but she's certainly getting up there, and you'd start to think that these teeth are not going to fall out. So that said, I don't think there's going to be a huge rush for Celia to rush her cat in and get them removed straight away. I'd probably give them 3 or 4 weeks or so and then just see if the baby teeth are loose. And if they are really loose, then they're probably going to fall out and it's not going to cause any problems. But if they're not loose, or if they really are persistently hanging around, they're sticking around and they're not coming out, then it's definitely going to be something to think about getting removed sooner rather than later. So rather than leaving them in until the cat is 1, 2, 3 or even older. And that's something that we do sometimes see. Like I say, it's more of a dog problem, and especially our small breed dogs, but sometimes you'll see they've got these retained teeth when a dog is middle or even really old, kind of reaching old age. And retained teeth, they do cause problems. So it's not just a cosmetic issue, with their mouths looking crowded, but they do push the adult teeth out of normal alignment, which can in itself cause problems. And there's also a tendency for food to become trapped between the baby teeth and the adult teeth. Everything's crowded in there and it can just kind of get wedged in, which can really quickly result in dental disease, which unfortunately is really a very common problem. It's a common source of pain and infection, and all too often, unfortunately, one that is overlooked. So unfortunately, it's going to be probably too early to assess the lower canines and to see if they're going to be retained, because it doesn't sound like they're going through yet. But the other thing to think about is, if the teeth have been pushed away, is there any evidence that they're actually digging into the palate? Are they growing or pushing into the soft tissues of the mouth when that mouth is closed? Is that going to be causing any problems? If it's, if it is, then it may be that they need to be removed at the same time as well. And that's going to vary to a certain extent on what the rest of the teeth look like, of course. But, Celia does say that it is known that this wee kitten does have an undershot jaw. So, it's something to bear in mind, and definitely not something to completely ignore. Now, like I say, this is a common problem, and actually one of the reasons, or one of the good things about the kind of standard or the traditional age of neutering or spaying a dog or a cat at 5 to 6 months is that one of the big pre-op checks is that we can check for these retained teeth. We can see if they are present, if they're likely to be a problem, and then remove them at the same time as that neutering or spaying procedure without the need for a second anesthetic and a second surgery. So we can combine everything together. Now, whether this traditional kind of 5 to 6 months of age for spaying or castrating, neutering is the right age or not is definitely up for debate. Now, when it comes to cats, there's definitely nothing wrong with getting them spayed, having that procedure at a younger age, and certainly our really early spay neuters that are often done in shelter situations, so that these kittens can then be rehomed without the worry that they themselves are going to have kittens at a young age and contribute to a growing shelter population. There's absolutely nothing wrong with that. I've written that a kind of a comprehensive review of spay timing in cats and neutering in cats in a separate article that I'll link in the show notes. And then when it comes to dogs, now, if you've got a large breed dog, and to be honest, the chances are if you've got a large breed dog, they're highly unlikely to develop any retained teeth. It's more the small breeds. But if you've got a large breed dog, there's definitely an argument for actually leaving that surgery until they're 12 months of age or even a little bit older. And again, that's something I've written in a separate comprehensive article, which I'll leave a link in the show notes. So definitely go and check those out if that's something that you're interested in.
Get your questions answered at callthevet.org.
And so if these baby teeth are retained and surgery is needed, it's actually fairly straightforward to get these teeth removed. Now, clearly it's going to involve an anesthetic. We need our patient to be still. It's going to be uncomfortable. There will be some bleeding of the gums afterwards, but actually the teeth are normally removed without too much bother, without really any complications. It's a little bit fiddly sometimes, and we need to be careful that the very long roots, and believe me, the roots sometimes are incredibly long, about twice the length of the crown, so the tooth that you see on the outside, and that is quite delicate, so a little bit of care is needed, but as long as that care is taken and the time's taken to do it properly, then generally they're removed without any problem, and your pet will be back up and running and actually eating fine and not having any problems the very next day or maybe the day after. So it's not something to really worry about. Obviously, every surgery, every anesthetic especially, does carry some risks, but those risks are very, very low. And especially in Celia's case, we already know that this little kitten has already had her spay surgery and come through that without concern, so I wouldn't be worried at all. So that's it for today's episode. I hope you enjoyed it. I hope you are happy that we've come back for this year. And like I said at the beginning, I've got some great questions already lined up. I think I've got 12 or 15 questions already lined up to answer. Now, if you want your question answered, then head over to callthevet.org, submit your question there, and I could be answering on a podcast episode soon. Also, make sure you tell your family and friends about this podcast to help spread the word, to allow me to help more pets live their best life possible, which is really what this is all about. So that's it from me. I'm Dr. Alex. This is the Call the Vet show. And until next time, take very good care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.